The heart rate monitoring feature on the Apple Watch represents one of the most significant advances in consumer fitness technology, but it's also one of the most misunderstood and potentially misused features. Let's break down what it can and cannot do for you. First, the positive case. Real-time heart rate monitoring allows you to exercise at appropriate intensity levels based on your actual cardiovascular response, not just how you feel. This is genuinely valuable because perceived exertion can be misleading, especially for beginners. You might feel like you're working extremely hard when you're actually in a safe, moderate zone, or conversely, you might push into dangerous territory without realizing it because you're distracted or determined to hit a target. The concept of heart rate zones is based on solid exercise physiology. Different intensities of exercise stress your cardiovascular system in different ways and produce different adaptations. Lower intensity exercise primarily improves your aerobic base and fat oxidation. Moderate intensity improves cardiovascular efficiency. High intensity training improves your maximum cardiac output and anaerobic capacity. Understanding these zones can help you train more effectively. For older adults, people with cardiovascular risk factors, or anyone returning to exercise after a long break, having this monitoring can provide genuine peace of mind. You can see objectively that your heart rate is responding appropriately to exercise and isn't spiking into dangerous ranges. This can reduce anxiety about exercise and make it feel safer to increase activity levels. However, here are the critical limitations and warnings you need to understand. The Apple Watch's heart rate monitoring, while generally accurate during steady-state exercise, can be less reliable during high-intensity interval training or activities involving significant arm movement. The optical sensor on the watch uses light to detect blood flow, and this can be affected by factors like skin tone, tattoos, wrist size, how tightly the watch is worn, and ambient temperature. More importantly, knowing your heart rate zones requires knowing your maximum heart rate, and most people use age-based formulas for this. The commonly used formula of 220 minus your age is just an average with enormous individual variation. Your actual maximum heart rate could be 20 beats per minute higher or lower than the formula predicts. This means the zones calculated for you might be significantly off. There's also a risk of becoming too focused on heart rate numbers at the expense of listening to your body. If you feel dizzy, unusually short of breath, or experience chest discomfort, these warning signs should take precedence over what your watch says every single time. The watch is a tool, not a medical device, and it cannot detect all forms of cardiovascular distress. For people with anxiety disorders or health anxiety, constant heart rate monitoring can actually be counterproductive. Some users report becoming obsessed with their heart rate numbers, worrying about normal variations, and developing increased anxiety about their cardiovascular health. If checking your heart rate during exercise makes you more anxious rather than more confident, this feature may not be beneficial for you. The recommendation to exercise in a safe, effective zone also oversimplifies what effective exercise actually means. Your goals matter. If you're training for a marathon, you need high-intensity work. If you're trying to improve metabolic health, moderate-intensity sustained activity is optimal. If you're recovering from injury, low intensity is appropriate. There's no single effective zone for everyone. Use heart rate monitoring as one input among many. Pay attention to how you feel, how you're recovering, whether you're making progress toward your actual goals, and whether your approach is sustainable long-term. The numbers on your watch are helpful data, but they're not the complete picture of whether you're exercising safely or effectively.